that, in fact, people who like their health insurance are going to be able to keep their health insurance, that there's no government takeover. People will discover that if they like their doctor, they'll be keeping their doctor. In fact, they're more likely to keep their doctor because of a stronger system. It'll turn out that this piece of historic legislation is built on the private insurance system that we have now and runs straight down the center of American political thought. Turns out this is a bill that tracks the recommendations not just of Democrat Tom Daschle, but also Republicans Bob Dole and Howard Baker. That this is a middle-of-the-road bill that is designed to help the American people in an area of their lives where they urgently need help. Now, there's some who wanted a single-payer, government-run system. That's not this bill. The Republicans wanted what I call the fox's guard, the henhouse approach, in which we further deregulate the insurance companies and let them run wild, the notion being somehow that that was going to lower costs for the American people. I don't know a serious health care economist who buys that idea, but that was their concept. And we rejected that. Because what we said was we want to create a system in which health care is working not for insurance companies, but it's working for the American people. It's working for middle-class families. So what did we do? What is the essence of this legislation? Number one, this is the toughest insurance reforms in history. We are making sure that the system of private insurance works for ordinary families. A prescription, this is a patient's bill of rights on steroids. So many of you individually have worked on these insurance reforms. They are in this package to make sure that families are getting a fair deal, that if they're paying a premium, that they're getting a good service in return. Making sure that employers, if they are paying premiums for their employees, that their employees are getting the coverage that they expect. That insurance companies are not going to game the system with fine print and rescissions and dropping people when they need it most, but instead are going to have to abide by some basic rules of the road that exemplify a sense of fairness and good value. That's number one. The second thing this does is it creates a pool, a marketplace, where individuals and small businesses who right now are having a terrible time out there getting health insurance are going to be able to purchase health insurance as part of a big group. Just like federal employees, just like members of Congress. They are now going to be part of a pool that can negotiate for better rates, better quality, more competition. And that's why the Congressional Budget Office says this will lower people's rates for comparable plans by 14 to 20%. That's not my numbers. That's the Congressional Budget Office's numbers. So that people will have choice and competition, just like members of Congress have choice and competition. Number three, if people still can't afford it, we're going to provide them some tax credits. The biggest tax cut for small businesses and working families when it comes to health care in history. And number four, this is the biggest reduction in our deficit since the Budget Balance Act, one of the biggest deficit reduction measures in history, over $1.3 trillion, that will help put us on the path of fiscal responsibility. And that's before we count all the game-changing measures that are going to assure, for example, that instead of having 5 tests when you go to the doctor, you just get 1. That the delivery system is working for patients, not just working for billings. And everybody who's looked at it says that every single good idea to bend the cost curve and start actually reducing health care costs are in this bill. So that's what this effort is all about. Toughest insurance reforms in history. A marketplace so people have choice and competition who right now don't have it and are seeing their premiums go up 20, 30, 40, 50%. Reductions in the cost of health care for millions of American families, including those who have health insurance. The Business Roundtable did their own study and said that this would potentially save employers $3,000 per employee on their health care because of the measures in this legislation. And by the way, not only does it reduce the deficit, we pay for it responsibly in ways that the other side of the aisle, that talks a lot about fiscal responsibility but doesn't seem to be able to walk the walk, can't claim when it comes to their prescription drug bill. We are actually doing it. This is paid for and will not add a dime to the deficit. It will reduce the deficit. Now, is this bill perfect? Of course not. Will this solve every single problem in our healthcare system right away? No. There are all kinds of ideas that many of you have that aren't included in this legislation. I know that there's been discussion, for example, of how we're going to deal with regional disparities. And I know that there was a meeting with Secretary Sebelius to assure that we can continue to try to make sure that we've got a system that gives people the best bang for their buck. So this is not... There are all kinds of things that many of you would like to see that isn't in this legislation. There's some things I'd like to see that's not in this legislation. But is this the single most important step that we have taken on health care since Medicare? Absolutely. Is this the most important piece of domestic legislation in terms of giving a break to hard-working middle-class families out there since Medicare? Absolutely. Is this a vast improvement over the status quo? Absolutely. Now, I still know this is a tough vote, though. I know this is a tough vote. I've talked to many of you individually. And, you know, I have to say that if you honestly believe in your heart of hearts, in your conscience, that this is not an improvement over the status quo, if despite all the information that's out there that says that without serious reform efforts like this one, people's premiums are going to double over the next 5 or 10 years, that folks are going to keep on getting letters from their insurance companies saying that their premiums just went up 40 or 50%, if you think that somehow it's okay that we have millions of hard-working Americans who can't get health care, and that it's all right, it's acceptable in the wealthiest nation on earth that their children with chronic illnesses that can't get the care that they need, if you think that the system is working for ordinary Americans rather than the insurance companies, then you should vote no on this bill. If you can honestly say that, then you shouldn't support it. You're here to represent your constituencies, and if you think your constituencies honestly wouldn't be helped, you shouldn't vote for this. But if you agree that the system's not working for ordinary families, if you've heard the same stories that I've heard everywhere, all across the country, then help us fix this system. Don't do it for me. Don't do it for Nancy Pelosi or Harry Reid. Do it for all those people out there who are struggling. Some of you know I get 10 letters a day that I read out of the 40,000 that we receive. Started reading some of the ones that I got this morning. Dear President Obama, my daughter, wonderful person, lost her job. She has no health insurance. She had a blood clot in her brain. She's now disabled. Can't get care. Dear President Obama, I don't yet qualify for Medicare. COBRA is about to run out. I am desperate. Don't know what to do. Do it for them. Do it for people who are really scared right now, through no fault of their own, who've played by the rules, who've done all the right things, and have suddenly found out that because of an accident, because of an ailment, they're about to lose their house, or they can't provide the help to their kids that they need, or they're a small business